my name is Saral. I'm third year student. Today I'm going to commence PCA to my patient. Good afternoon, Mrs. Adib. My name is Saral. I'm one of the third year students. Today I'm going to look after you. I just went through your notes and it says that doctor has written you up morphine for your pain. I'm going to give it to you very shortly, but before that, can I check your details with you? Could you just state your full name for me, please? Adib Miriam. And your date of birth?
7th of Feb, 69.
1969, yes. Your MRI number is 174963. Mrs. Adib, are you allergic to anything?
No.
No, okay. I also would like to ask your pain. 10 is being worst and 0 is being no pain. How would you score your pain?
8.
8. And also, can you just tell me where's your pain exactly? Around your ribs?
Yeah.
Around up
yeah.
here?
Yes.
Okay. Alright. Okay, Mrs. Adiba, I'm going to get your medication. In the meantime, if you need anything, here's your buzzer. Press your buzzer too. Also, I'll do initial sets of observations on you. And also, let me check your side. Do you feel pain when I touch it here?
No.
No? There's no swelling, no redness? Okay, Mrs. Miriam, I'll be back shortly. Thank you. Alright, would you be my second RN to validate my medication order? My patient Adib Miriam today she's been ordered for morphine. I have checked her details against her armbands and with her too. Her name is Adib Miriam. Date of birth is 7th of 1969. She's under Dr. Hunt. Her MRI number is 174963. She has a history of post-fracture ribs. She has not any allergies. It's been written here. Today she's been prescribed for morphine 50 mg in 50 ml signed by doctors, and it's been dated and doctor's name here. And the details is 50 mg morphine, normal saline, in normal saline 50 ml, concentration is 1 milligram, number of syringes is 3, PCA dose is 1 milligram, lockout interval is 5 minutes, basal infusion is 0, hourly dose is 12 milligram, and here's doctor's signature. Also, she's been prescribed for antiemetic medication, metoclopramide, dose 10 mg, route IV, interval TDS, it's been signed and dated. Also, she's been prescribed for another antiemetic medication, Nexalon, dose is 0.2 mg, route IV, interval 2 to 3 minutes. It's been signed and dated by the doctor. So also, it's not been given yet. So do you agree with this medication order?
I agree.
Yep, thank you. Now I'm going to get my morphine out. Okay. 15 it's morphine. Okay. Today's order is morphine 40 mg in 50 ml. So before I do that, let me count my medication. This is all morphine sulfate. Morphine sulfate, morphine sulfate, and morphine sulfate. I'll put it down here. Morphine sulfate, expiry 10 mg 2 ml. It's all morphine sulfate. There comes with 10 mg 2 ml. Expiry is 1020. So let me count it. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yep, 10.
10, okay. So, alright. So according to my calculations, it's a 50 ml. Since this ampules comes in 10 mils, I'm gonna use 5 ampoules to make it up 50 milligrams. Okay, so 1, 2, 3, 4, 5. So leaves me 1, 2, 3, 4, 5. Balance would be 5. Okay. 18, 05, 17. What's the time now? 12:24. My patient name is amount given is 50 mg. Balance would be 5. Okay. So if you're happy with these things, could you sign here for me, please? Your print name and signature. Signature will be here.
Okay.
Okay. Okay, I'm just gonna put my medication here. Okay, I've got my acid morphine here. So I would, before doing my first drug check, I would just want to check in the names for the adverse reaction for this medication. Okay, morphine sulfate use opioid analgesic treatment for chronic severe pain. Indications opioid hypersensitive, acute asthma, obstruction airway disease, acute respiratory depression. Precaution, chronic severe non-malignant pain, high dose prolonged use. Adverse reaction would be respiratory, circulatory depression, hypotension, and it could cause GI upset too and constipation. Okay, now I know the adverse reaction of this medication. So I'm gonna do my first drug check with you. Would you be my second RN to do it?
Yes.
Okay. And this medication is compatible with 0.9 sodium chloride. That's what my order says. Okay. Could you come here this side? Okay. My patient name is Adib Mariam. Her MRI number is 174963. Date of birth is 7th of 1st, 1969. She's under Dr. Hunt. She has a history of post-fracture ribs. She has she does not have any allergies. It's been written here. She's been ordered for today morphine 50 mg in 50 ml. It's been signed and dated by the doctors and doctor's name under here. So 50 mg morphine in normal saline 50 ml. So I've got morphine here. According to my order, I've got 5 ampoules of morphine here. They are morphine sulfate 10 mg 2 ml expiry 1020. 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 Morphine sulfate comes with 10 mg 2 ml expiry 1020. Also, I have to mix this medication with the normal saline. I've got 4 normal saline because I have to make it up 50 ml.
Yeah.
I'll just take this one out. Okay, so all of them are sodium chloride. Sodium chloride 0.9, expiry is September 18. Sodium chloride 0.9, expiry September 18. Sodium chloride 0.9, expires September 18. 0.9 sodium chloride expires September 18. Yeah. So let me read my medication out. Morphine 50 mg in normal saline in 50 ml. Concentration is 1 milligram. Number of syringes is 3. PCI dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 and hourly dose is 12. It's been signed by doctors. And also she has been prescribed for metoclopramide antiemetic medication, dose and route 10 mg IV, interval TDS. It's been signed and dated by the doctor. Another is Nexolon, dose and route is 0.2 mg IV, interval 2 to 3 minutes. It's been signed and dated by the doctor. Also, it's not been given yet.
Yep.
So after my first drug check, I'm gonna drop my medication. My last 10 pills. Okay, so I have drawn up 40 mils of normal saline. I'm gonna draw up my morphine now. Okay, so according to my order, I have made it 50 mils.
Okay.
50 mils. Just before priming my line, I want to just do my second drug check. So, do you need my second RN to check this drug?
Yes.
My patient name is Adib Mariam. Her date of birth is 7th of 1st, 1969. Her MRI number is 174963. She's under Dr. Hunt. She has a history of post fracture ribs. That's what she has a pain. She doesn't have any allergies, so I've checked with her too, and also it's been written here. And today she's been prescribed for morphine 50 mg in 50 ml. It's been dated by signed and dated by the doctor. And morphine 50 mg morphine in normal saline 50 ml. Concentration is 1 milligram. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval 5 minutes per push. Basal infusion is 0 milligram. Hourly dose is 12 milligram. And here's my morphine ampules. according to my order, I have used 5 ampoules. Here's morphine sulfate. Comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate 10 mg 2 ml, expiry 1020. Also, I have used normal saline and 4 of them. So they all are normal 0.9 normal saline. Expiry is September 18. Okay, 0.9 sodium chloride, expiry September 18. 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 So they are within the date. This has also been prescribed for antiemetic medication, metoclopramide. Dose and route is 10 mg IV, interval TDS, signed and dated by the doctor. Also another medication, Naxolone. Dose is 2 mg, route is IV, interval 2 to 3 minutes. It's been dated and signed by doctor, and it's not been given yet. Now I'm going to just prime my line. Okay, my line has been primed. Okay, before I go to my patient, I want to do my third drug check since I have primed my line. So would you be my second RN to check these drugs with me? Okay, my patient name is Adib Mariam. Her date of birth is 7th of 1st, 1969. She is under Dr. Hunt. She has a history of post-fracture ribs and she doesn't have any allergies. Today she has been prescribed for pain relief morphine, 50 mg in 50 ml. It's been signed and dated by the doctors, and doctor's names here. This is the ampoules. I have morphine drugs. I have used it today, 5 ampoules. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. Morphine sulfate comes with 10 mg 2 ml, expiry 1020. They all are within the date. Also, I have used normal saline to make it up 50 mils. Sodium chloride, 0.9 sodium chloride, expiry September 18. 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 Okay, they are within the date. And here's my concentration is 1 milligram. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes per push. Basal infusion is 0 milligram, and hourly dose is 12. It's been signed by doctors. She's also been prescribed for antiemetic medication, metoclopramide, for the adverse reaction. Dose and route is 10 mg IV, TDS, interval TDS. It's been signed and dated by the doctor. Here's another drug, Naxolone. Dose and route is 0.2 mg, route is IV, interval 2 to 3 minutes. It's been again signed and dated by the doctor, and it's not been given yet. Okay, I've done my third drug check. Now I'm just going to do my second patient check. Let me do my irritated levels. Patient name is ID 174963 1969. Morphine 15 ml. So 50 mg divided by 50, it would give me a 1 mg per ml. 1 mg per ml. 0.9 normal saline. Today is 18th, time 12:24, prepared by me. So if you're happy, could you just sign here for me, please? Yep. Now I'm going to do my second patient check. Mrs. Adib, I'm back with your medication. So before I give it to you, that I still need to check your details with you. Is that okay with you?
Yes.
Could you state your full name for me, please?
Adib Medium.
And your MRN number? I'll check your MRN number. Could you just tell me your date of birth, please?
7th of February 1969.
Okay, let me check your MRN number. It's 174963, 174963. Mrs. Adib, are you allergic to anything?
No.
No, that's good. Do you still have pain?
Yes, I do.
So how would you score your pain out of 10? 10 is being severe pain and 0 is being mild pain.
8.
8 is still 8.
Yeah.
Okay. Do you feel pain when I touch here?
No.
No swelling, no redness, nothing there. Okay, I'm just gonna prime your line. Okay. Just set my PCA machine. Okay. Things here. Alright, drug name morphine. Calm down, lock up for 5 minutes. Next limit is 16. I want to alternate. To my hourly dose limit 12 mg, so I'm just going to change it to 12 mg. Okay, 12 mg. No, okay, confirm. Protocol summary morphine 1.0 mg, dose mg, lockout 5 minutes. So 5 minutes, maximum dose of 12 mg. Yep. Okay. Okay. Performance range. Okay. All right. My PT is start to begin. Here's my medication order. Okay. Okay, Mrs. Adib, I have already checked your cannula side. Now I'm just going to clean it up before I connect this line to you. Okay, could I have this straw, please? I need to.
Okay.
I'm just going to give you a very good clean, about 15 seconds, or it could be more than that. Okay. I'll just put this one in the bin. Type it. Thank you so much. Okay. Okay, Mrs. Adib, I have connected this PC line to you now. You can have it whenever you are in pain, but you have to press this green button. This is the PC green button. You have to press it whenever you are in pain. Once you press it, you will get another dose only after 5 minutes. So I was just wondering if you could press this one for me. Yeah? Yeah, and whenever you press it, you'll hear the beep noise and the light will click, so you will know you are getting this morphine or pain relief medication to you. I will just leave this buzzer here for you. And also I'll let you know that if you feel this morphine can cause you constipation, drowsiness, and nauseated, if you feel any of these symptoms, if you occurs, just let me know. I'll come and check you. Also I'll come back around 15 minutes to check on you. Here's your buzzer. If you need anything, you can press on your buzzer. Your PCA is going through now. So I'll be back within 2 minutes to check you. Thank you so much, Mrs. Adib. Put this thing here. Now I'm just going to sign my medication. That is 18 05 17 12 24. Sign. Would you mind to sign here for me, please? Yep. So I have started my patient that I'll also do the initial set of observations. It's 18 05 17. So here's my signature. So would you mind to sign here for me, please? Yep. Yes, now I'm going to dispose my things here. Okay. I'll wash my hand. Alright. Today I have commenced my PCA to my patient. My patient is having her PCA. Thank you so much.